Staffing was significant. We're very fortunate prior to the pandemic. That has always been a huge priority for us, was to have really good staffing levels. So when the pandemic did happen, we already had very good staffing levels. Board of directors, they're always all about the employees and what we can give back to the employees. During COVID, we gave everybody a 10% increase in their wages, whether we had COVID in the building or not. That lasted, I think, for a full year. When we did have COVID, if you worked in the COVID unit or in the unit where people had symptoms, you made $5 an hour more while you were working in that COVID unit. I think our success was right from the start when COVID started back in early March. Was we immediately started with planning and having a COVID committee that met 3 times a week. We started planning what we were doing at this time as far as infection control, the cleaning of the building, keeping it clean, pretty much stopping anybody that didn't need to come into the building from coming into the building, doing the screening of staff and anybody that came into the building diligently. Anybody with any sort of symptom, they were immediately asked to leave the building and stayed home per the CDC guidelines. Like they had to, even if they tested negative, they would stay home the full 14 days, in the beginning before they were able to come back to work. We limited movement of staff throughout the building. Everybody had their space that they needed to be in. That's where we stayed. When we did have residents with symptoms, they were immediately brought to a separate area where they had dedicated staff for that area that took care of them. When we had a COVID unit, they were separated. People that were positive were separated from people who had symptoms and didn't test positive for COVID yet, and from the other parts of the nursing home. And we had dedicated staff for all 3 areas so that there was no cross-contamination. Really just controlling what was coming in the building, the movement in the building, the testing, the amount of testing that we did when we did have a positive staff person or positive resident would significantly reduce the spread. I always base my decisions on what is best for the residents. And I always want to do the right thing based upon what is best for the residents. When I have a decision to make, that's always what's in my factor. What's maybe best for the staff person, but ultimately what's best for the residents.